Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am one of your co hosts, Jocelyn Turner. I tell you what, to our listening audience who endured with us for the past 4 years, I am super excited to tell you that next week we will be celebrating our 200th episode of Pause for the Truth. We are just so honored and so thankful to all of you who've tuned in with us week by week. And of course, we've taken off holidays and vacations, but for the most part, we have remained faithful to doing the podcast every week, and which is why we always end the show by asking you to please subscribe to our YouTube channel. I thought I'd say that from the beginning, Dr. Kane, because I'm just so excited that we're about to celebrate our 200th episode. Before we bring in our guests, Dr. Kane, how are you doing this evening?
I'm doing absolutely marvelous since I'm still here. Not only, I'm happy to see our guest here now, but part of our 200th episode may be that we ask these gentlemen to have a quick cameo appearance to make sure that we let people know and acknowledge how they've contributed to our show to the point to where we made it to 200 episodes. So, we're going to make sure we send out those invitations for that cameo appearance. They don't have to be how long, but at least for us to be able to acknowledge them and thank them and show the audience our appreciation above and beyond what they actually do on the show.
Yeah, and tonight's topic, Dr. Kane, is such an important one for folks who were born in the 50s and beyond and before and all that other good stuff. I was talking to some colleagues today, and one of them, I was telling them what we were talking about tonight, Medicare, and they said, "Oh, can I get Medicare?" Brian and Earl, she was born in 1972. I was like, "Girl, go sit down somewhere." 1972, really? It's not quite time yet, right? And you don't want to speed it up. But joining us tonight are Brian Hicks and Earl Jones Jr. They've both been with us before, and we're excited to have them come on and talk about. And by the way, to our audience, it seems like I still haven't got it. This Medicare subtopic. And so every year, Dr. Kane says it's open enrollment. Open enrollment is about to start. We need to have someone on to come on and talk about it. But I was listening, Brian and Earl, on the news, and I want to welcome you all. But this morning it was so relevant and so just all of a sudden there was a story on the news that there are people who have been on Medicare for years and don't understand their plans. They, have issues with them, and they're questioning whether or not they have the right plan. So welcome. How are you both doing this evening?
I'm good.
Good. Thank you.
Wonderful, wonderful. Well, thank you so much. So let's go ahead and delve into it and talk about what are some of the biggest myths or misunderstandings you encounter about Medicare. Brian, I'll start with you.
Well, some of the biggest myths. Well, some of the, I would say, misunderstandings. Especially when someone is turning 65, they typically don't know where to start, and some people believe they start with with CMS and Medicare, but actually they start with Social Security and making sure that they secure their Part A and Part B. So that I think that's the biggest thing. And then another thing, some people get confused with the Medicare supplements and the Medicare Advantage plans and how they work, because there's three systems. You can have just original Medicare if you like, but then also you can do a Medicare Advantage plan or a supplement. So I think to me that's the three biggest misunderstanding.
Thank you. And Earl, what about you? What are some of the biggest myths or misunderstandings you encounter about Medicare?
Um, there's a lot. I guess I could say, like Brian said, enrollment. When does it occur? When do they need to enroll? What do they need? What is A? What is B? What is Part E? What is Medigap? Is that the same thing as a supplement? Which it is, but a lot of stuff is can be difficult to navigate, and you know, prescription coverages. Some people don't really understand how the prescription coverages work, and the changes that they make. Medicare makes changes almost every year to different aspects of their coverages, and not a lot of people really notice until they kind of go to the doctor's office or they go to pick up their prescription. So having making sure their doctors are in network. There's been a lot of changes over the years as far as you know, uh, carriers and the hospitals that they cover, and a lot of people kind of get blindsided and don't know until last minute. I've actually had a client who's scheduled to have a surgical procedure, and they didn't find out until 2 days before the procedure that they no longer take their health insurance, the Medicare. So, things like that. I think um, people think it's a lot easier than it actually is until they get to enrollment.
Wow.
Well, Ms. Turner, the one thing that I will say is that there are plenty of physicians who take Medicare don't understand how Medicare works. I want to make sure our layman audience can appreciate that Medicare is not as simple as what we would like the understanding of Medicare. Not as simple as what we would like like for it to be. That's why we have experts like these two gentlemen to help guide us through not only the layman or the general population, but also the so-called medical experts like me. They call me a medical expert for whatever reason. But we need to make sure we understand it for our patients to be able to understand.
Yeah, I think the question that I've had with people, a lot of people work beyond their age 65, right? So what if you're working past age 65 and your employer offers insurance? Do you have to enroll in Medicare, or do you accept your job's health insurance plan? And do you need to weigh the difference to see which one is better than the other? And I'll let either of you answer that question.
Brian, you want to take it? I could take it up to you.
Okay. Well, they have the option. I mean, if they are, say, if a person is staying employed with their employer, and they have what we consider credible coverage, so that's one of the stipulations. So they won't get a late enrollment fee. But if they're staying at their employer past the age of 65, they can do that. But typically, we recommend that they at least establish their Part A, which that's no cost to them, additional cost to them. And then once they establish that, if they want to retire, a few years later, they'll get a special enrollment period for a delayed Part B, and so they don't have to feel pressured to do that, because once they establish the Part B, they will be charged the Part B premium. Even though there are some Medicare Advantage programs that will reimburse them for that Part B, but just like Earl was saying earlier, that's where it gets complicated. To whereas you have to know the different ways to establish your Medicare, because but the long and the short of it is that they can stay on their employees. As a matter of fact, we encourage them to talk to their benefits department first before they do anything, and then from there we can let them know if it's advisable. We can decide if it's advisable to go to straight Medicare.
Yeah, and if I could just add on that, he's exactly right in what he's saying. There is a one thing that a lot of people may not realize is the size of their company or employer. There is a difference between, what we consider small employer and large employer. So, if your employer has more than 20 employees there, when you enroll, if you decide to enroll, your Medicare will become secondary and your employer coverage becomes primary. Now, if you have a small business or you work for a smaller company, if you do decide to enroll at that time, either Medicare becomes primary, employer insurance becomes secondary. So there's a little difference between the size of the employer, if that makes sense.
That's interesting. So if your employer, the company you work for has more than 20 employees, then your Medicare is secondary
Mm-hmm.
to your.
Yes, Medicare becomes secondary, employer coverage becomes primary, and it is very confusing. Sometimes I could get confused. I got to go back and read up on it because it's a lot. And also, if your employer is smaller than 20, sometimes you have to you have to enroll in your Medicare when you turn 65. So that's a big difference between 20 and over and 20 and under.
So say someone is turning 65 soon.
Mm-hmm.
What's the very first step they should take when it comes to Medicare?
Well, they need to go to socialsecurity.gov and they can enroll online. I mean, you got options as in calling in to enroll in your Part A and B. And if you're going to do original Medicare, you're going to want to enroll in the Part D, which is your prescription coverage. Some people choose Medicare Advantage plan, which, are all three. But the first step is to enroll in, Part A, B, and D. Because if you don't, during your enrollment period, you can be penalized, and that penalty doesn't go away. So I would suggest they either go online, ssa.gov. They can schedule an appointment at their local office, wherever they're located, or call in. I believe, personally, I do everything online, most of the things. So I think, if they're able, if they have a computer, you probably can use your phone, go online and do it. I believe that may be the fastest way.
I was going to say, good luck with
shutdown. Yeah, with the government shutdown now, folks can't call anyway, right?
There's that, and there's that. That's a new thing. So it's kind of hard to give advice on what's the fastest way right now. I would like to believe that they're still processing enrollment applications, for people turning 65. But everything's kind of fluid right now, and I know that from what I understand, is a lot of things are up in the air.
I have a client that's. I'm sorry. I apologize.
No,
I have a client that's in that situation right now, and that's in South Florida, and she said her local her local Social Security office is still open, so she's going to go down there in person and apply.
Can you briefly walk us through you've talked about it, I call it the alphabet soup of Medicare, parts A, B, C, and D, and what does each cover?
I'm gonna take that. Okay. Your Part A is typically your emergency room coverage for anything you got to go to the hospital or urgent care. That's generally your Part A. Your Part B is your primary care. When you go see your primary care doctor, that's your Part B. And the Part A is generally, if you worked in the U.S., majority of your life, Part A is you don't pay for. Part B is right now, I believe, $185 a month for your primary care physician. Part C is what you call Medicare Advantage. And that consists of, your emergency room, your primary care physician, and most of them come with prescription coverage, which is Part D, which was the next one. Part D is prescription coverage. You can get prescription coverage separately, but you can't get it, usually with your Advantage plan, it comes with it. And then there's Part E. That's what the people call Medigap or Medicare supplement. That's a little different. Medicare supplement generally, come with a monthly premium. They're usually a couple $100 a month. A lot of people do like the supplements because, you get a lot of coverage. You know, your copays go away. You can go to any hospital anywhere that takes, you know, Medicare. They'll take your supplement. You know, like I know some people here in Jacksonville, they like to go to Mayo Clinic, and you know, they pretty much only take supplements. You know, if you had an Advantage plan, you can't go there. You know, so those are the main A, B, C, D, and E.
So I'm sorry, when you talked about, you said part A,
Mhm.
that's ER, but then you said part C is also ER, and you said B is PCP,
So
and C,
so part
you
part
have C.
C is part C is your Medicare Advantage plan. That's a plan that kind of encompasses everything: your prescription care, your
Okay.
primary care, your urgent care. You know, it's kind of an all-in-one type of plan. They even come with, you know, free gym memberships, and some of them come with, you know, depending if you have
That
Medicaid,
one.
depending on if you have Medicaid or not. That's what they call a dual. When you have Medicaid and Medicare, when you have that, you know, there's additional benefits. Some of those specialized plans come with, you know, sometimes they come with a card that you can use to buy food. You can use it for utilities. I remember a plan this year or last year where you can, I think some of them allow you to purchase gas with it. But you know, a lot of people see these commercials, and that's another thing. Probably should go back, because that's one of the myths that people see on TV, is that they can get this food card for $400, and they don't tell you that you got to also have Medicaid. And I get a lot of people calling me about that, saying, "Well, how do I get the food card?" And you know, do you have Medicaid? And you know, usually the answer is no. And you know, that's what they don't tell you on the commercials.
One of the things I want to make sure that our patients, that our listening audience can appreciate. You did say PCP, but it's any of these doctors' visits, not just PCPs. It covers specialists as well. Is that not correct?
Correct.
Okay. I just didn't want them to think that it only covers PCP.
Yes.
How
So
do
yeah, I should have included that. Yes, it does. They do cover your primary and specialists as well.
Other specialists.
how do people make the decision, Brian, of choosing straight Medicare versus Medicare Advantage, and what's the difference? Is it almost like a HMO versus a PPO?
That's part of it, but really, and especially going forward, because there's a big issue now with utilization, and the utilization is determining how much the insurance company receive from the Medicare Trust Fund as far as premiums per month, because a lot of the Medicare Advantage plans are zero. But the choice comes down to uh, your family history or your personal history as far as health is concerned. Like Earl alluded to, a lot of the cancer centers, for an example, will not take Medicare Advantage plans. They'll only take Medicare supplements. So, and then the other thing is that when you first age, what we call age into Medicare, you have the option of going with a Medicare supplement, for an example, and it's guaranteed issued. So you don't have those health questions. So the person's health, obviously their ability to either pay for a supplement, which can average anywhere from $200 plus then a month, plus the prescription drugs are separate, and then also whether or not you travel. People that travel a lot, that's a question that comes up a lot. If I travel, can I go see any doctor? Well, if you have a Medicare Advantage plan, for an example. Now, if you have a Medicare supplement, yes, there's no network. But if you have a Medicare Advantage plan, the problem is the network. So if they are traveling though, and it's an emergency, it's treated as in network. So really, what it comes down to is that's probably the biggest part of me and Earl's job, is to do an upfront analysis to see what's best for that individual, their lifestyle, their affordability, and that's really what it comes down to, because there's almost an infinite amount of options, especially you're a broker, and you represent several companies, and that's really what it comes down to. What's most important to them. I've had people put an emphasis on the over-the-counter benefits, And in recent years, though, the over-the-counter benefits have been reduced because of utilization. And and they'll decide, okay, I want like we were talking about the healthy card, and they're on what we call a D-SNP, one example. They have Medicaid. Well, and with some of the carriers, because of utilization, they don't realize that when they get a healthy card, they say, well, my neighbor can get groceries on his or hers, and I can't. Well, one of the rules of utilization is that if you have one, you have to have one condition like diabetes or high blood pressure, and a lot of people don't realize that when they just think it's just one standard rule. So and that has to do with utilization. So it really comes down to a good needs analysis up front, and really determining what's between us and the client, what fits their lifestyle and affordability the best.
Do me a favor, Brian. Talk a little bit about, and Earl, you can follow after Brian answers. Talk a little bit about what you do when you talk about your client, and tell people how you help people, and what your role is in the process. Like, you are an insurance broker, right?
Yes. Mm-hmm.
And what does that mean?
Well, that means I represent multiple companies, and that means that and because all the commissions and everything are standardized throughout the industry, so I like to use the term, I don't really have a dog in the race when it comes to a certain company, which CMS has structured it that way, and that's why they have some controls over the commission. So I would have a less incentive of giving that individual, directing them, steering them to a certain company, because they're going to pay me more commissions. Now, early on, and I've been in financial services since '89, and early on when Medicare started to kick in, especially in the early 2000s, it was the Wild Wild West as far as commissions are concerned. I mean, so and that's why it's structured that way. So I really, my whole thing is that I help the individual more by uncovering what their needs are, because a lot of times, and Earl could attest to this, a lot of times people go by what their neighbors tell them what they have and the benefits they have. And so that's one of the things that we have to overcome and realize, get them to realize you don't necessarily qualify for that, or that's not something that's available to you. So just to make it so this, the process is not complicated, we uncomplicate the process, and then we bring it to a point that people realize this has to do with my health, my affordability, and me individually. So that's
so true what you said, Brian. People, we talk to one another, but then we ask one another for a restaurant recommendation or a place we can go and get our car fixed. So we're just so accustomed to feeding off of other people. If you're just tuning in, we're talking about Medicare Made Simple, what you need to know if you're turning 65, or maybe you currently have Medicare and you've been having some challenges, you're thinking about switching plans, because that's the other piece. Earl, was there anything you'd like to add in terms of your role in helping folks with Medicare or even other insurance? I know our topic tonight is Medicare, but talk a little bit about how you help people.
Yeah, just I help protect families, and whether it's life insurance, health insurance, or Medicare, I disability and things like that. I help try to figure out what the family needs, and at being a broker, I believe I have an advantage, because we can kind of help them shop around different carriers. They may not, I get clients that say, I hate United Healthcare, or nothing. I don't believe nothing's wrong with United Healthcare, by the way, if they're listening. But some people just have their preference, and their doctor might not take Humana or Aetna, so being a broker, it's helpful because we can shift and go in another direction if they're not liking their current plan or stuff like that. So I do every year I schedule appointments with my clients, and we go over the new plans because the plans do change every year, and we go over what do you need. Has there been any health changes? Are you taking additional prescriptions? Because prescriptions can, depending on what it is, some of them can be $0 and some can be hundreds. So being on the right plan is important because that can impact them financially if they're on the wrong plan.
Can you be on an Advantage plan and have a Medigap plan?
No.
That's illegal.
Yes.
Oh, okay.
Time to
Why-
go to jail.
Yeah.
Why is that? I'm sorry. Because Advantage is supposed to cover everything.
Well, why? I mean, why is it illegal? I really can't remember exactly why, but technically you're there are two health plans. It would be doubling, duplicating what you have, and as an agent, we're required to know that and to not suggest that or even try to enroll somebody in that. It's pretty severe penalty. It's not something that we definitely discuss that during our meetings with our clients. It's just not, you just can't do it, and if they try to do it, they'd tell them that too. It's just not possible.
It's two different systems. And I just remind individuals, because that's the great part of being a broker, is that I just remind individuals there's three ways they can access Medicare. That's just original Medicare. They can do that, a Medicare A and B, and get a Part D standalone prescription drug coverage. They can get a Medicare Advantage plan, which is, as Earl alluded to, is Part C, which encompasses all, A, B, and D. The real issue is that when you go with a Medicare Advantage plan, the Medicare Advantage plan becomes your primary. When you go with a Medicare supplement, the Medicare Part A and B, your original Medicare, is your primary. So they first bill original Medicare, and then they bill your Medicare supplement, and with the Medicare supplement is what we consider pure insurance, because it's that's regulated by the state with other insurance companies. It's medicated by the state also, and it's standardized by the federal government. The Medicare Advantage plan typically is not governed by the state. Everything goes through CMS because it becomes your primary, but you never lose your original Medicare. So you're dealing with different governing bodies, and that's why they don't allow you to get both.
That makes sense. So when should people start planning for Medicare enrollment, and what happens if they miss their initial enrollment period?
I'll just jump in real quick. You get, before your 65th birthday, there's technically a 7-month window, 3 months before your birthday, the month of your birthday, and then 3 months after the month of your birthday. So it's a pretty big window. The penalties can be, like I said, they're permanent. If it's a Part B penalty, it's technically 10% for every 12 months that you did not enroll when you should have. And for your Part D, which is your prescription coverage, it's 1% for each month that you did not have that. And, just for people to be clear, that's not something that's just a 1-year penalty. That goes for the duration. So, I try to, do as much as I can to let people know, because, you'll experience that penalty, for the duration.
And duration
rest of your life.
Yes.
Earl, I know you need to hop off a moment, so we'll just see you back in a few minutes. And
yes, I'll be right back.
Brian, we're going to continue the conversation with you. And again, if you're just tuning in, we're talking about Medicare made simple. At least we're trying to make it simple. And Brian Hicks has been doing this. Brian, I think you talked about a long time. I don't want to age you and say how long, because Dr. Kane always says he's the oldest person on the podcast. So, but so when are there special enrollment periods for people who continue working after 65? Well, we already talked about that.
Yeah, there are. I mean, it depends on their circumstances, and every year, for an example, and this is relevant to Florida, there are special enrollment periods that occur because of the weather. For an example, if they miss the enrollment period, there's special enrollment periods based on their circumstances, whether, and then also whether you move out of the service area, whether they discontinue a certain plan. So there's several special enrollment periods. I think the most important thing is that 7-month window when you're dealing with somebody who's turning 65. The sooner we interact with them during especially the prior 3 months to the month of them turning 65, we can advise them and let them know when would be the best time to look at enrolling in a Medicare Advantage plan.
Yeah, it's so you say that as though, like it's just so simple, but where's the playbook that tells you if you're turning 65, you need to let the government know I'm still working, so I'm not about to enroll in Medicare or Social Security? That's the sad part about it. Like, who tells you that?
That's
Dr. Kane, the
unfortunate.
primary care doctor? I'm just saying, how do you know
Well,
that?
it depends on your employer too. The employer, the benefits department, if you're still working at that time, the benefits department should make you aware that you have the option of at least picking up your Part A, and you have the option of still enrolling in their insurance. Now, as long as their employee insurance is what they consider credible coverage, it has to meet at least the minimum standards of the what the government set forth for the Medicare Advantage plan. So the employer is very important. That's why early on when we're trained as brokers or agents, we're trained to first instruct the person to talk to their benefits department, and then you have a situation where when people are military and now with if they have VA benefits, now that's one of the few situations where they can have a Medicare Advantage, MA only, Medicare Advantage only, not the MAPD, which is prescription drugs. If they're getting their prescription drugs through the VA, and that's considered credible coverage, there's special Medicare Advantage plans, with someone called Patriot plans and other names that they can get, and also they can have that, and then they can still go to the VA.
Yeah, I think about people I've known in my life, family members or just others, who've talked about their aging relatives whose health changed. And they've had Medicare since they were 65, but now they are 80s, 90s, or whatever, and their health changes and they need Medicaid. And then and trying to navigate that, or either trying to navigate some of the options like long-term care if they have to move their loved one from being at home into a facility. Does Medicare pay for, say, a long-term care in terms of a nursing home or what have you?
No, that's strictly Medicaid, long-term care and Medicaid, and that's strictly based on their income and assets, or whether or not they will qualify for that. Now they do have, those are what we call dual, what we call dual special needs plans, where when they qualify for state Medicaid and they have Medicare. Now, there's other plans, what we call CSNPs, and that's for chronic diseases like diabetes, heart disease, lung disease. and that's another category of special need plans too, which doesn't require income and assets verification.
So if
So
someone doesn't qualify for Medicaid, they can qualify, they can purchase that plan that you're talking about now?
um, if they don't qualify, there's just regular Medicare Advantage plans that when a person either turns 65 and they're on just Medicare A and B, they can get, or there's the dual SNPs, which it just depends on. Again, it goes back to their lifestyle, affordability, and where they are income wise, and they try to they try to address multiple situations with individuals because some people retire, they've done well in their working lives, and they still make good money. That could be a good candidate for Medicare supplement plans, and especially if they have savings and they have assets. An individual that may have worked lower paying jobs throughout their work history, and now they're qualified. They're just living off Social Security, and they would be they would be qualified for the dual SNPs. And then a person that has developed any chronic diseases, they can qualify for the C SNPs. So it comes back to the needs analysis and really asking the right questions to be able to address the person's lifestyle and their affordability.
So if you're on Medicare, you have a Medicare Advantage plan, you're still supposed to play. I was looking at a slide a couple of slides ago. If you have a Medicare Advantage plan, which is Part C, do you still pay for Part B or no?
Yes.
You do.
Now you do also have the option of there's some Medicare Advantage plans that have a give back feature that will reimburse you for the Part B also, depending on the carrier. So again, it really comes back to an individual allowing us the opportunity to give them the correct counsel to really understand their lifestyle, affordability, and their goals. I mean, and also, when I say, like, do you like to travel? Do you travel a lot? I mean, do you do you go to the doctor very often? And do you see? Then there again, do you see a specialist often? Do you have in the last 5 years? Have you been hospitalized multiple times? It's just I had, and I want to let Earl get back in here, but I had an individual that this was about 13 years ago. She the wife had a triple bypass, and back then we could do the Plan F. So she called me frantically, and she after the surgery and everything, and she said, "You got to get over here and look at what this bill they sent us." Well, it was just a summary, and it was and the bill summary was $445,000, and she thought that that's what she owed, but she had a Medicare supplement. So Medicare paid their portion as the primary, and then the Plan F took care of the rest. So I mean that's it's you
That's
hope
not
to
an option anymore, huh, Brian?
huh?
Medicare F went away.
But FNC went away. But you have the G and some of the other plans that are still good plans and yeah, but the F has gone away. But the people that have F, they got to keep it.
Yeah. So if you're tuning in, by the way, and you are turning 65 this year, other than a big celebration, you've got to make a phone call or go online to the government and declare whether or not you still have health insurance, say with your employer, or you are declaring that you want to enroll in Medicare. Did I say that right, Brian and Earl?
Well, if you have credible coverage, like Brian said earlier, if you have credible coverage, you don't have to call them. You can just you won't have to worry about that until you get ready to leave that employment. You get I believe, an 8-month window after you decide to retire and leave that employment. So you don't. So I guess the answer is you don't need to call Social Security if you're maintaining that credible coverage through your job that includes credible prescription coverage as well. So
Yeah, I thought I did, Earl. So I did call the Social Security and I told them I'm still working. Hey, but oh gosh, I'm telling my age now. I'm sorry. Darn it, I didn't mean to do that.
Too late.
Oh, you tricked me, Earl. You tricked me. You made me say it aloud.
Well,
okay, I'm sorry. I apologize.
You can. I just quickly just want to say, you can call and enroll in your Part A because there's no cost associated with it. But I would never, I wouldn't advise them to enroll in Part B because you're going to start paying that Part B premium, $185 a month, and if you don't need it, why enroll in it? Your job coverage is credible, so there's no, it depends. But like Brian said, everybody's situation is different. Can't listen to what your neighbor says because their situation is different. So it's good to have a broker that can walk you through those things and kind of learn a little bit about you and what your situation is because everybody's unique.
So no, that wasn't exactly wrong what you did. It wasn't exactly wrong.
Gotcha. Yeah, I don't play with the government. So how can someone estimate their out-of-pocket costs under Medicare? I know you just mentioned it's 185 for Part B, but
Part B, yeah. So the difference between a major difference between original Medicare, Advantage, and supplements is that original Medicare is great because if you travel, you can go anywhere that accepts Medicare. The thing that the hang up is when you are experiencing out-of-pocket costs. Advantage plans and supplements have limits to where you pay a certain amount, you no longer have to come out of pocket. Problem with, I ain't gonna say problem, but one thing about original Medicare is there is no limit on out-of-pocket costs. So if you get that, if you have major expenses, they're not going to cap it on original Medicare, and I would say that's one of the drawbacks. Even though original Medicare has benefits, it's just that's one thing that kind of sticks out that I definitely tell people that are considering original Medicare is that cap on out-of-pocket costs. That's
that's scary. That's why so many people I know have decided they chose the Advantage plan, but then when they talk about the limitations. The one thing I thought about though is there are people who have Advantage plans, and many of us have seen some hospitals and insurance companies who've been in disagreement, and folks want to go to a certain hospital that they used to go to under their Advantage plan. And then when they try to access that hospital, they're told your plan doesn't allow you to come to this hospital again. Like one of you, I think, Earl, you referenced Mayo Clinic being in Jacksonville, that Mayo doesn't accept the Medicare Advantage plan. So to both of your points, it depends on your situation, your health issues. But in this case, this person was going to a certain hospital, and because of the dispute, I call it a dispute, the hospital and the insurance company was having, they're no longer now able to go to this hospital. So now they want to change their Medicare Advantage plan to be able to go to the other hospital. So before you choose a Medicare Advantage plan, should you ask your broker, like one of you, what hospitals can I go to? Can I go and see Dr. Kane? I've been going to Dr. Kane forever and I want to continue going to him. What is that? Are those questions that you should ask before you choose whatever plan you? Oops, I muted myself before I Brian, you're muted.
That's part of our job, actually. That's one of the things we're expected to do is to go over your networks with you. Mm-hmm. And again, that's part of who you choose to use as for medical providers. And alluding to what Earl had talked about before about the limited liability if you just have straight Medicare. For an example, in Part A, if you're hospitalized, you just have Medicare A and B. There's a $1,676 deductible when you go to the hospital for the first 60 days, whether you're in the hospital for 1 day or 60 days. So, and Earl hit that on the nose as far as that's why it's important to talk to a professional about what's best for you, because you may have individuals I've had individuals tell their friends, all you need is Part A and Part B. That's all you need. And they don't warn them about the unlimited liability. They don't warn them about the deductible for hospitalization, the standard deductible. So that's real important.
But as it relates to the unlimited liability, that is kind of somewhat ameliorated to a degree by the supplement with the regular Medicare, correct?
Right. A supplement would be your secondary.
Right.
But that'll cover your unlimited liability. But they're advising people to just go with Medicare, because and part of that is it has been ignited because of the networks. Because some people say, I don't like Medicare Advantage because they have networks. So if you stay on just original Medicare, you won't have a network, but you'll have a limited liability also.
Unless you get supplement.
Yeah, unless you get a supplement, but these are people that can afford a supplement, and they're being advised just to be out there with original Medicare, which you have the right to do that.
So what do people do when they travel if they have an Advantage plan? Is that when they would get the travel insurance?
Well, they can, if they're in a PPO, generally they can anywhere, whatever county or city they're in, they can find a network physician. HMOs are a lot more restricted on, out of network. You can't really go out of network and see a physician because, they generally won't cover that. PPOs, you can travel with that. If you're going on vacation to California, you shouldn't have a problem, just going to their website or calling your agent, and they can help you find a physician in the area where you can go.
But if you're out the country, that's where you would tell people, if you're going out of the country, I do as a travel advisor, I always advise people to purchase travel insurance. So have you ever received calls from people by telling them, hey, I'm going out of the country, will my plan cover where I'm going? Or do you?
I haven't. I don't know if have you, Eric?
Yeah.
Okay. Brian, I'm sorry.
I'll just give 2 examples. I had I don't know how long this was ago. It may be about 15 years ago. But I had a couple that was in Italy. They went to Italy, and the husband got sick. And I do advise them to get travel insurance. And the reason I advise them to get travel insurance is because, as you would know, Jocelyn, the travel insurance companies are educated on the rules of that particular country. So, in his case, he did have travel insurance. We later found out that the province he was in Italy, if he had not had travel insurance, they would have made him pay with a credit card because they have to get paid by Medicare. Now, Medicare, he's on a Medicare. He was on a Medicare Advantage plan. No, he was on a Medicare supplement. But still, it just depends on where you go. It's better to have that aggregate amount, as you know, Jocelyn, of 50,000 or 100,000, and they can get covered right away. And then you also have some representation when you're in another country as far as navigating you through that health system there. And that's the main reason I advise that. I just had somebody that went to Slovenia, and she goes back every other year. Her and her sister, they always get travel insurance because of that very reason, and I advise it. But if they don't, I mean, It just depends. It just depends. I mean, I've had people that go as close as Mexico, and they're asking for a credit card for the expenses, especially if they're hospital, what have you. So
Yeah. So, Dr. Kane, if you, Tyrone, can you go back to the slide that talked about the dates? And it may have been the one before this, so that before we close, okay. Before we close the show out, I want people to know about these important dates that are coming up, because I think open enrollment starts October 15th, if I'm not correct.
Correct.
So can you all talk about the enrollment periods and explain to people who are about to enroll in Medicare or need to make changes? Can you talk a little bit about the enrollment periods?
Sure.
You sound real good saying it first, Earl. Go ahead.
Yes. So what they call an AEP is the annual election period, enrollment period. I'm sorry, annual enrollment period. That is October 15th, which is next Wednesday. Right now, if anybody's listening that does want to start discussing plans, we are able to discuss it with you. We are not allowed to enroll you until the 15th. And that'll go through December 7th. And that's every year. That's the same date. That plan will not be effective December 8th. That plan will be effective January 1st of next year. So, I know a lot of people, I do health insurance and stuff like that and dental vision. Sometimes plans can be effective next date or next month, but this would be effective January 1. So you would, if you're currently on an Advantage plan, you'll continue to be on that plan through December 31st. And then your new plan will be in effect to January. And then October 15th of 2026, you're going to probably get a call from me again, and we're going to do the same thing again. So it's kind of every year thing. So, that's why it's good to have a broker that, you can trust, and that helps you every year, because, things change and they change fast. And, that's, the first enrollment period. Now there's another enrollment period. The second one is January 1st through March 31st. Those are only for people that are already enrolled in Advantage plans. So you can't enroll in an Advantage plan during that time if you're not already on one. So that allows you to drop or switch. That makes sense.
And I mean, when you say drop, meaning you can go from the Medicare Advantage back to original Medicare?
Correct. In a Part D plan, because remember, your original Medicare doesn't come with prescription coverage, so you have to enroll in a separate standalone Part D plan if you do that. So during that January 1st through March 31st, you have the opportunity to either switch Advantage plans or drop your current Advantage plans. If you're not enjoying it and want to go back to original Medicare, you can do that. But you also just need to make sure you enroll in a Part D plan.
Now, while I don't have slides I give to the patient, we will make these slides available on the website. But I do discuss particularly about these key enrollment periods, just in a brief like this. I have kind of a little a sheet of paper I can give them with this information. The one thing I'm going to ask, particularly both of you guys, is that so when the week, like right now, you said it's not going to start until the 15th or whatever. So now is a good time. It's now a good time to start. At least call your broker and let him discuss your current situation.
Yes, and the reason
already enrolled is what I'm saying.
Yes, yeah. If you're already enrolled in an Advantage plan, yes. I mean, it's the time to start having those discussions. A lot of my clients get these phone calls every year around this time, especially when they turn 65. I mean, what I try to help them understand is that, I can't stop these calls from happening, but it's not legal for you to receive phone calls from agents that you do not know. You can, however, get mail and email, which is legal. They can mail you and email you all day long, but you're getting phone calls and you don't know who they are. That's illegal activity, and that's not allowed. So, generally, if it's a new client of mine, technically you're supposed to reach out. You got to call me. So, you get my phone number, give me a call, then we can start the process of engaging and having that conversation. But, we're not, you can't, by law, you're not allowed to give me somebody's phone number and say, hey, I want you to call this person. They need Medicare. They have to reach out first.
Well, yeah, in my office, what I do is, the people that are brokers, I give them, those individual phone numbers and tell them that they can reach out to them.
Yep.
But can they call me? I'm like, no, I'm not going to have them call you. I have you call them.
Yeah.
To keep it clean, I'm not sure if they can do it after the 15th in terms of calling you. I just know before the 15th they cannot.
Oh, they can. No. They definitely can. They can call any time of the year.
I mean the insurance expert call the patients before. I say patient, but they call clients before October 15th. They cannot. Can they call them after October 15th?
Can you repeat that again? I had a hard time.
As a broker, I know you're not going to reach out to patients before October 15th. They can reach out to you, but you won't reach out to them, correct?
Unless they're existing client. If they're already,
that's what I mean. New clients. I'm sorry, new clients.
Yeah, if they're already current client, we can talk. They can call me. If I've engaged with them and they've done their permission to contact forms, which is what they call permission to contact. Yeah, I can call them. That's no problem. But if it's initial, the first contact, they're by law, you have to call the agent first. Then you sign the permission to contact, and then it opens the door to I can call you now.
Is that any time? Does that include that can only happen any time of year, or in terms of
yeah, it can happen any time of year. It's just that I can't during the October 1st. After October 1st, I can discuss the actual plan benefits. So they specify basically I can talk about Medicare in general year round, but right before open enrollment, October 1st, I can now start talking about how much benefit this plan has versus just speaking about Medicare in general. That makes sense.
But is it true? The only thing I'm just trying to make sure I understand that you can talk to them after October 1st if they reach out to you first. For new clients.
We can talk.
Now, can you reach out to new clients after October 15th? Can you, or is that a no period?
Yeah, it's a no. We're not supposed to reach out to clients that we do not know yet by phone. Now we can email them. We can email them and send a letter or postcard. But.
Now I think what Doc is referring to is that we can educate them any time of the year.
Yes.
Now the date that Earl was talking about, October 1st, that would be relative to the new plans that are coming out the upcoming year, because sometimes people are aging in during the year or what have you. So they can talk to us any time of the year. The only restriction we have is that the plans that are like right now, we're getting close to annual enrollment, that we can't really discuss. It's a certain time frame we can discuss those particular plans before they're actually established in the coming year. But if someone talks to us April of this year and they want to and they're aging in May or June, we can talk to them and we can educate them. We can educate them at any time, but there are some restrictions on. We'll have information on the plans coming out. We've had information on the plans coming out in 2026 since the beginning of October, but that's a restriction. We can talk about those plans from October to October 15th, but we can't enroll them until the 15th. But we can educate them any time of the year.
So how can caregivers or adult children help their loved ones make informed decisions about Medicare?
Well,
No, go
Well,
ahead. Go ahead, Brent.
okay.
Good.
The best is still the same situation. They need to get with a good broker or agent. Now the only drawback with agents is that they own, if they're captive, they're gonna lean towards the plan that they represent because that's all they have to offer. But the same thing, it's about education, and an individual can have a conference call, and like Earl says, most of our work is done over the phone, over the internet now. But they can have a conference call, and we could talk to them about their lifestyle, affordability, what they're going through, and especially as people change as far as their health is concerned. Whereas before, if they at age 65 they didn't go to the doctor as much, but now they're in their 80s and they're concerned about going to the doctor. They may have upcoming surgical procedures, and you need to really thoroughly go through the co-pays, the co-insurances that are relative to outpatient surgery or hospitalization, and try to find a plan that fits them the best as far as affordability and lifestyle.
So speaking of which, speaking of which, Brian, are there programs that help low-income seniors pay for premiums, deductibles, or prescription costs?
Yes, LIS. It's extra help from Social Security, and it's called LIS. So if they qualify, now a person can not qualify for Medicaid, but they may qualify for LIS, and that's limited income subsidy and that's strictly for prescriptions, and that is paid through Social Security. So,
but it's just for prescriptions, but premiums or deductibles, there are no assistance programs for folks to help pay for that
for their
any premiums or deductibles.
Well, a lot of times, if people are in that category, they'll typically have a Medicare Advantage plan, and most Medicare Advantage plans have a zero deductible. Now, the LIS does, depending on their LIS status, they can get their Part B paid, and also obviously if they get Medicaid, they get even more benefits, but. That's limited income subsidy through Social Security. There are some state pharmaceutical plans that will help, but it just depends on obviously how the person qualifies. So yeah.
Well, we're at the end of the hour. I don't want to keep you. I want to respect your time. So I would like to just offer each of you the opportunity. First of all, thank you for coming on, but would like to offer you the opportunity to share your final thoughts or any last minute piece of advice you'd want to give someone who is about to enroll maybe or make any changes. And also in your answer, if you could include your contact information so that we could make folks aware of who you are and how to get in touch with you. And Brian, I'll start with you.
Okay. Well, real important. And one of the things is that because you have so many companies and so many individuals that there are soliciting seniors, one of the things that they try and do is they'll ask a person a question about Medicare supplements or market to them about Medicare supplements, because Medicare, so again, that system is just in what we call pure insurance. They're allowed to solicit them for the Medicare supplement, but then they'll quickly change to the Medicare Advantage plan. Mm-hmm. So individual needs to be careful to whom they're speaking with, and what they're representing as far as plans and things of that nature, because they're getting a plethora of calls right now. And it's best to, if you can, get referred to a broker that someone has dealt with and can trust. Because a lot of times when they deal with people like that, they write the policy and that's it. They don't have any follow up. They don't have any connection to them after that. So I would say that's the main thing, to watch who you're working with.
And how do people get in touch with you, Brian?
You can get in touch with me. I'll give you my toll-free number and my cell phone. My toll-free number is 800-716-1866. And my cell phone is 321-604-5928.
Can you put those in the chat, Brian, so that we will make those available on our website?
Yes.
And thank you. Thank you. Earl, what are your final thoughts, and how can people reach you after tonight's show?
Yes, thank you. Well, I just want to say thank you, y'all, for having me on. And I just want to say, for people out there listening, Medicare doesn't have to be confusing. We just, give me a call or Brian a call, and we can, help simplify it for you and kind of work through it. So it doesn't have to be confusing. I know it can be overwhelming. The way you can reach me, my number is 904-556-0156. And you can reach me also by email. It's just earljonesjr@outlook.com.
Well, thank you. Dr. Kane, what are your final thoughts? And thank you for the great PowerPoint presentation.
Yeah, the one thing I will say, because I don't have to be out of this, I'm just going to list real quick, and this is the PowerPoint will be on our website. But what I do one of the reasons that we brought these gentlemen on because they are brokers. They are expert with what they do. Brian happens to be my expert because he enrolled me into Medicare many moons ago, and he continues to
a lot too.
he continues to keep me updated on what's the best choices that I have, and as well as Mr. Jones being a medical expert as well, a expert broker. It's just so happened I met Brian before I met Mr. Jones. So, and Brian has served me well, Mr. Jones. I'm pretty sure has served you well, Mr. Turner. I think that
Yes,
is
sir.
your broker. And it's not so much that we playing favoritism, but we know who we have in front of us when we bring these two experts on. Not saying anybody else is not, because I have some relatives that also do this, but at least these two gentlemen, we know for sure that they are pillars in the community as far as it relates to Medicare expertise. Real quick, this is just some additional resources that you can look at. I don't know how personalized it'll be compared to these two gentlemen. I know they won't be as personalized, but there are still resources by which our audience can get to. I'd like to thank both of them for coming on this evening, help clear up some of the stuff with Medicare, but I am sure 2 minutes after the program is over, we're going to have plenty of people that go, okay, I got another question. How do you do this? How do you do that? So reach out to these two guys, either one of these guys, and they can help answer your question, and it's free of charge.
Absolutely.
Thank you. And if you're just tuning in, or if you missed the show, Earl Jones Jr. and Brian Hicks are insurance brokers. Back in the day, we used to call them insurance agents or insurance man. How the old folks used to say the insurance man, but they can help you with your option. As they both said, they represent different insurance plans. They're not just selling one insurance company's plans. So as we close tonight's discussion, I want to remind everyone that Medicare is more than just a health insurance program. It's a pathway to maintaining your independence, your peace of mind, and your quality of life as you age. Turning 65 should be a milestone you celebrate, not stress over. The information shared tonight is meant to empower you to make informed choices, to ask questions, seek guidance, and take control of your healthcare decisions. If you're helping a parent, a spouse, or a friend navigate the process, know that your support can make all the difference. And if you're feeling overwhelmed, remember, you're not alone. There are trusted professionals like Brian and Earl and community organizations that Dr. Kane shared with you on the previous slide who are available to help you every step of the way. And as always, thank you for tuning in and for continuing to pause for the truth with us each week. And don't forget to tune in next week as we will be celebrating our 200th episode of Pause for the Truth. We've been around since 2021, and I just want to give that plug to you right there, and you'll learn more. It's going to be a special podcast. So thank you for tuning in, and thank you again to Earl Jones Jr. and Brian Hickson. Yes, Earl is my insurance man. He's about to sign me up, y'all, for Medicare. Good evening.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.